So first I would want to thank our collaborators. So we have Dr. Amit from the University of Texas Medical Branch, who is not here today, as well as Dr. Angela Heads, who's a clinical psychologist and works in our substance use clinic innovations at UT Physicians in Houston. So the problem that we want to address is reducing the treatment gap for alcohol use disorder. So our title, Exploring Consumer and Patient Internet Searches and Activities Related to the Diagnosis and Treatment for Alcohol Use Disorder, came about because since COVID, there's been an increase in the prevalence of alcohol use disorder, particularly among racial minorities and women, yet it remains largely untreated because it's a highly stigmatized condition. So our research question centers around, do internet searches, does the information found online, does it impact really the readiness to change? You know, the recognition within the individual that they may have problematic alcohol use, and is the information that they are finding, does it help them talk to their providers and help them to receive a formal diagnosis of alcohol use disorders, to receive referrals to treatment, as well as does it somehow improve engagement? So we are using a mixed methods research design. So first we are aiming to conduct 3 focus groups among patients at our UT Physicians clinics in Houston. This is through the University of Texas system. It's a huge primary care group that spans Southeast Texas. And what we will do is recruit patients for the focus groups, and part of our interview script, which has received IRB approval, seeks to determine whether or not if the patients are finding information online, is it helpful? Do they perceive it as being accurate? What is the quality of the information they are finding? And then we will also seek to find terms that they're using for their searches that we can maybe look for when using natural language processing. So our second part will be to analyze Google takeout data. So we will be recruiting patients at the point of care. I worked with our medical directors and providers to actually have them recruit the patients. Just because of the stigma of the condition, we don't want to send research assistants to recruit patients. And then once we receive the Google takeout data, we will de-identify it, we will link it to our electronic health record data and store it for further analysis. So we're also conducting a social network analysis of our electronic health record data. So at our clinical data warehouse at UT Health, we have over 6 million patient records. We've already extracted 5,100 records that contain an alcohol use disorder diagnosis from 2022 to 2024. We're going to conduct some preliminary analyses kind of to establish a baseline for referral and engagement patterns. And then once we recruit our patients and analyze their Google takeout data, we will also get permission from them to access their EHR data. And we're just going to be accessing a few basic variables, utilization, what medications they were prescribed, but we want to try to determine if it's possible to link the Google takeout data to their EHR data. And those are our pilot aims for now. And also through the focus group process, we may look at adaptations for our study based on patient-reported information. Thank you.